the infection, they are seen in adults as well as children. We have a lot of knowledge about treating infection in adults, but every adult physician, when he encounters a child, he is always scared of treating because he thinks it's different. And that's what we are going to discuss today, that how to treat or how the infections in the children group are different. So Dr. Rajeev Uttam, he is the expert for today, who is the senior pediatric intensivist at Max Hospital, Patparganj, New Delhi. So Dr. Rajeev, what are the differences between infection in adult and children, particularly in the critical care unit?
Rajesh, more or less the infection which you see in adults, we see in pediatric patients as well. But when in a small child, like in a newborn and a child who is up to 5 to 7 years of age, there are certain specific infections which do not happen in adult. Like you have a newborn baby, he is more susceptible to having infection from the mother's vaginal tract. There is chances of more of a gram-negative infection as well as chlamydia, which can pass on. Children and small babies are normally immunodeficient compared to an adult and an older child, so they're more susceptible to getting an infection. The respiratory infections are much more common in children than it would be in adult population. And children are normally more susceptible because of when they start a play school, they are exposed to many more viruses, and viruses are supposed to be much more common infection in children than compared to adults.
Why are the pediatric infections different?
They're different because a child is growing. You know, when they're growing, their organs are growing, and certain organs are more susceptible to it if they're infected early. Like, for an example, you have a child with rotavirus infection. I'm sure it does not happen that much in adult.
Rotavirus for causing diarrhea?
For causing diarrhea. This is a very, very serious viral infection. And child, like you have a children with cystic fibrosis, you know, which is not happening in adult population, and they're much more susceptible to getting a pseudomonas or a staph infection.
So what are the common infections in children?
The commonest most still remains the respiratory infection. In this, the viral is the main cause, and followed by strep pneumoniae, or if you have a very small baby, you have a different bacterial flora which causes infection.
And if you look at the community-acquired infections, so what are the common community-acquired infection in a child which presents in ICU?
Okay, we can see if a child is less than a year. Or